Myths versus facts about male infertility, revealed. Infertility is defined as the inability to have children after 1 year of sexual intercourse without contraception or protection. Although in our society, women are often the ones to blame, but in fact men can also experience it. Infertility in men can be in the form of low sperm count, slow sperm movement, abnormal sperm shape, or disruption of the reproductive tract. Myth 1: Men are better in boxers than panties. This may be based on the belief that tighter underwear can create a high temperature in the testicles so that it is not good for sperm production. However, in a study that compared the temperature of the testicles in men who wore boxers and panties, there was no significant difference between the two, especially that wearing boxers could increase sperm production. It is true that an increase in the temperature of the testicles can affect sperm quality, but it is not clear whether this has anything to do with underwear that is too tight. Myth 2: A man's age has nothing to do with his fertility. Maybe you've often heard that a 60-year-old grandpa can still get a girl pregnant, so a man's fertility has no effect on his age. But the fact is the number and quality of sperm will begin to decline when a man turns 40 years old. The decline itself is slow and gradual. However, this can be made worse if the man has a urinary tract infection or varicocele. A study says that men also have a biological age, which ranges from the age of 40 years. Just like women, men also experience changes in their bodies and reproductive systems with age. Although sperm production does not stop, sperm production and transport structures can weaken over time. Myth 3: Diet and weight gain affect male fertility. This is true. Obesity can reduce hormone levels in men and can lead to diseases such as diabetes and hypothyroidism, which can lead to impaired sperm production and azoospermia, which is the absence of sperm in semen. A diet rich in fish, chicken, fruit and vegetables can help increase sperm motility. Young men who are obese may have lower sperm counts than their normal weight counterparts. The findings, reported in the journal Fertility and Sterility, add to evidence that obesity is associated with relatively low sperm quality. Recent studies have found that compared to leaner men, obese men tend to have lower sperm counts, fewer fast-moving sperm and less progressive motile sperm, which refers to sperm swimming forward in a straight line rather than moving aimlessly. Myth 4: Frequent masturbation can lower sperm count. It's true, masturbation that is too frequent can reduce sperm count and quality. So if you want to have sex, it should be 2 to 3 days interval to improve sperm quality. In addition, masturbation in men can cause the effect of the emergence of the habit of masturbating, which can only tend to cause psychological problems where thoughts arise constantly to masturbate. In addition, the act of masturbation can also cause injury and an increased risk of infection in the genitals due to the use of objects that are not guaranteed to be clean. Like anything else, too much of anything is not good. A person with a habit of masturbating too often can experience sleep pattern changes, stress, anxiety/panic, weak, lack of concentration, which in turn can also cause erectile dysfunction and impotence, because of these psychological factors. Myth 5: Taking certain supplements can increase male fertility. Until now, there has been no research that proves that taking certain supplements can improve sperm quality and production. although in some studies there are those who recommend consuming L-carnitine, L-arginine, zinc, vitamin D, vitamin E, selenium, coenzyme Q10, and folic acid can increase sperm production, but has not been proven.